Hello, and thank you for joining us. Whether you're joining us live or listening to the recorded version, you can access us a bunch of different ways. You can access us all these ways that you see here, and we'll talk more about how to ask questions in just a minute. But we welcome you to episode 4, Desire in the Real World. Okay, how are you going to ask? You can go to our website if you want to find out more. You can watch previous episodes. You can look at what's coming up next week and the following week and the following week after that, because we have awesome, amazing people coming to help educate you on sexual health. So go to the website and learn more. You can also see all the different ways to access. If you have a question, and you're on YouTube, you can see here how you'll go to the chat box to ask a question, and we will get that question. If you're on Facebook, this is what it looks like. So you can ask your question. And also, you can ask a question. In addition, this is really exciting. We are now on all of these, besides all those other social media things, we're on Spotify, we're on Amazon Music, podcasts, all these different things. We are there, and you can listen to us while you're in the car, wherever you are. Dr. Jeff talks about sex and intimacy. Take us with you, and we hope you will and learn more. All right. First off, I want to remind you that everyone is welcome here in this space, regardless of sexual orientation, regardless of gender identity, and regardless of your relationship style. If you're joining us for the first time, let me remind you, our goal is simple. Our goal here with this podcast is to enlighten and inform you with evidence-based information to improve sexual health, to deepen intimacy with your partner, and to enrich your relationship. As we begin this evening, as always, there's a lot of great information, and I'm excited about our guest sharing his expertise with you this evening. I want you to remember this as we move forward. Whatever you desire, you are inherently enough. You are uniquely and marvelously made. But you are also intricately connected to other human beings and the world around you. Let's start talking a little bit about desire. I'm going to pull up my slides and just introduce the topic. So, what is desire? Well, here's two good definitions that I like. One is from Levine, and it says the sum of forces that lean us towards or push us away from sexual behavior. So that's one definition. I think that sums up some of it. Now, Sandra Liebman says it's a subjective, motivating feeling or state triggered by both internal and external cues, which may or may not result in overt sexual behavior. There's a couple different components. One of the biological components is that drive, that sexual drive. There's also expectations and wishes. That has to do with things that we've culturally derived, that we've learned from our culture or the things around us, but our expectations and wishes about desire. And then there's also the component of our motivation with desire. Well, I think that gives us an idea of it. Let me go to what can go wrong. Can we have desire disorders? Absolutely. A desire disorder is also known as hypoactive sexual desire disorder, and it's characterized by persistent or recurrent, it's not just a one-time thing, but a persistent or recurrent lack of sexual interest or desire. And this causes distress. This is a really important point, because if it doesn't cause distress, then it would not be a correct diagnosis. So if someone has a lack of desire and it doesn't bother them, then that excludes them from usually that diagnosis that we would use. Is it prevalent? Absolutely. Wow, this is pretty interesting. According to the research, 8 to 30% of women and 5 to 15% of men have a hypoactive sexual desire disorder. It's most common in women, and particularly, not surprisingly, during midlife and postmenopause. So many people are suffering with this. In fact, this is the most common sexual dysfunction is a desire disorder. Well, why is that so important? Because it can impact the person themselves and their self-esteem. It can affect their relationship, and it can affect their overall life satisfaction and quality of life. So that's why we're here tonight talking about desire. I want to remind you that nothing we do here or anywhere that you go replaces one-on-one comprehensive evaluation and treatment with a qualified healthcare professional for sexual issues. But finding a qualified provider can be challenging, right? So, a couple resources. The Sexual Medicine Society of North America, of which I am a member, you can go to their website, go to resources, you'll see a drop down menu, and then find a provider. That's for like medical care. That's to see a healthcare provider that can help you with some of the physiologic medical issues that you may have concerns about. The American Association of Sexuality Educators, Counselors, and Therapists can also be accessed at their website, and you just go to the provider button. You know about this podcast, and I also have a book out there that you can download for free, the PDF of, and that is what that resource. The Urology Care Foundation also has some great information. So there are some really good resources out there, and we were talking about it, Vic and I, after the last episode, and I wanted to share some of those with you, especially how to find good providers. Sexual Medicine Society, American Association of Sexuality Educators, Counselors, and Therapists. Dr. McCarthy and I are both certified by that organization. So you can find some very good people with that. Without further ado, I am really excited because I have learned so much from our guest this evening. And so I would like to introduce you to Dr. Barry McCarthy. He is a professor emeritus of psychology. He is a diplomat of clinical psychology. He's certified as a sex therapist and a couple therapist. He's published well over 100 professional articles, 33 book chapters, and 24 books. I have a couple books out there, and 24 books is pretty astounding. Barry is presented to hundreds of professionals at workshops all over the United States and internationally. He also is the recipient of the Masters and Johnson Award for lifetime contribution to the sexuality field. So without further ado, I am delighted to introduce you to Dr. Barry McCarthy.
Good. Jeff, nice. Thank you for the invite. And it's really nice to be here. I like talking about sex and sexual desire.
Awesome.
But let me start off with an apology. And let me tell you, the apology is what we as professionals have told you about sexual desire. And what we're going to try to do is to confront some of those myths that we built up ourselves and are built up in the lay public. When you think about sex therapy, Masters and Johnson are the grandparents of the field. And one of the things that they did when they talked about sexual problems is they ignored sexual desire, which is not unusual. There was a belief, and a strong belief that still exists in the world in 2025, and that is, as long as you have arousal and orgasm, whether you're a man or a woman, whether you're straight or gay, everything is fine. That's nonsense. The most important thing about sexuality is positive sexual anticipation, that you feel that you deserve to have sexual pleasure in your life and in your relationship. And you can be intimate and erotic allies in creating that. And I'm a great fan of arousal. I'm a great fan of intercourse. I'm a great fan of orgasm for both women and men. But that is not the way to promote desire. The way to promote desire is to directly address what allows you to build bridges psychologically, biomedically, relationally, so that you look forward to and anticipate sex and sexual pleasure. And if there's one thing I want you to remember, this is it from today. And that is what you see in the literature, what you see in the movies, what you see in porn. It all says to people that the way to feel desire is spontaneously. Feel horny, feel that you want to be sexual. And it happens or it doesn't happen. You either are sexual or you're not sexual. Spontaneous desire, I'm in favor of spontaneous desire. I want to be clear about that. I am in favor of it. But that is not the basic way of being sexual. The basic way of being sexual is called responsive sexual desire. The concept was developed about 15, 20 years ago for women. It is very, very relevant for men also. So that spontaneous desire, when it occurs, is great. But what is much more genuine, what is much more teachable, is how to turn towards your partner and develop responsive sexual desire. So if you think about arousal on a 10-point scale, 10 being orgasm, 0 being neutral, it's perfectly normal and natural to begin a sexual encounter at 0 or 1 or 2. And that as you engage in and are present for giving and receiving pleasure-oriented touch, that's when you feel desire. So arousal happens first and then desire occurs, in most cases with most men and women. That's a reading. If you hear nothing else from this one, remember nothing else. This is the core one I want you to remember. I also want you to confront a myth that is very powerful, both professionally and in the lay public. And that is that male sexual desire is more genuine than female sexual desire. That women are always playing catch up. That men are inherently more sexual. And that the male model is a model of spontaneous erection or desire and totally predictable sexual performance. That's the way most men in their teens and 20s and 30s learn to be sexual. But that is not a healthy learning. It works for a while, but it doesn't work in an ongoing life, in an ongoing relationship. One of the pieces of data that really surprises people is when people over 60 stop being sexual. It's almost always the man's choice, not because he wants to stop being sexual, but because he's lost his comfort and confidence with erections, intercourse, and orgasm. And he says to himself, I don't want to start something I can't finish, so I avoid being sexual. One of the things I want to emphasize today is that there's two things that really, really poison desire. The one is the traditional male-female power struggle, where the man has an easy arousal and desire, and he says to his partner, what is wrong with you? Why can't you be sexual like I am? Why can't you get easily aroused? Why can't you have easy orgasms during intercourse? Nobody wins a power struggle. Power struggles are poison for sexual desire, not just female sexual desire, but for couple sexual desire. When you get stuck in a power struggle, you're in big, big trouble. The other notion is that if you really love the person or you were intimate enough, that sex would easily flow into desire. In responsive desire, you build bridges to desire. You bridge psychological bridges, biomedical bridges, relational bridges. What are your conditions for healthy sexuality? So it's a aware and it is a positive process. And you want to enjoy that awareness and you want to enjoy that positivity. Now, the other thing, I am a big fan, I want to be very clear about this. For both men and women, I love intercourse. Intercourse is a wonderful, wonderful couple sexual experience. But intercourse and intercourse frequency is not the essence of healthy sexuality. There's a new mantra in the sex field. So now we're going away from the myths to the new mantras, the new information. The new mantra in the sex field is desire first, pleasure second, eroticism third, satisfaction fourth. They're different phenomena, but it gives you a different way of understanding and talking sex with each other. And the most important component is the first one, responsive sexual desire. What allows you to be open and willing to give and receive pleasure-oriented touch? And that's the second component. Pleasure is the measure, as Emily Nagoski says. Pleasure is the measure. That individual performance is not, and frequency is not the best measure of desire at all. What is sex really supposed to do in people's lives? It's supposed to energize your bond. It allows you to feel like you're an energized, special couple. And it reinforces feelings of desire and desirability. That's the role of healthy sexuality. And at the essence of it is pleasure, not performance. The essence of it is being intimate and erotic allies, not performing for your partner. There's so many couples who are good at intimacy and intimate connection, but not good at sexual or erotic connection. They're both, and it isn't that intimacy belongs to women and eroticism belongs to men. That's another one of those myths. Both men and women can value desire, pleasure, eroticism, and satisfaction. There's many more similarities than differences. But the biggest thing is to understand that it's a 1-2 combination. You're responsible for your own sexuality. Your partner doesn't give you sexuality. The partner doesn't have to give you desire and orgasm. Your partner is there as your friend and is basically your cheerleader and your teammate. Ultimately, sex is a team sport. And the biggest problem with desire problems are the most common sexual problem. More than premature ejaculation, more than female pain, more than non-orgasmic response. It is desire. It's the problem of low desire and discrepancies in desire. Let me make a really important point about discrepancies in desire. What we used to believe when I trained to be a sex therapist was absolutely wrong. And that was to increase the desire of the lower desired partner. In 2/3 of cases, the lower desired partner is the woman. But in 1/3 of cases, it is the man. He often doesn't admit that it's a desire problem. He says it's another kind of problem, or he's not turned on by his partner. The issue with his desire is he has de-eroticized his partner in his relationship. And the biggest problem typically for females, because there's desire problems are multi-causal, multi-dimensional, with large individual couple cultural and value differences. But the major issue for women is she loses her sexual voice. That early in the relationship, usually before they become a permanent couple or live together, get married, there's a limerence phase. What limerence means is high degrees of romantic love, passionate sex, and idealization. I love the limerence phase, but it is very fragile. It lasts between 6 months to 2 years. You've got to replace limerence with developing your own couple sexual style. It's another important concept. That you two need to be playmates, intimate partners in developing a couple sexual style that works for you. What you mean by that is how you individually as a couple blend 3 very different phenomena. Intimacy, which is all about feeling close and open. Pleasure, which is all about giving and receiving touch and allowing that pleasure to build and to flow. And eroticism, which is what allows you to let go and be highly aroused and highly orgasmic. So it's that blending. There isn't one right way to do it. Different couples have different couple styles. But one of the most valuable things to understand is for most couples, their relational style, how they relate as individuals, as a relational team, is not the same as their sexual style. For most couples, again, married or partnered, straight or gay, the best relational style is a best friend relationship. Where Sue Johnson said it really well. You believe your partner has your back. But that's not the best sexual style. The problem with the best friend relational style is that you feel so close to each other that you wind up de-eroticizing the relationship and de-eroticizing each other. You'd rather hang out and be loving rather than engage in playful and sexual touch. Another core concept. That touch is really, really important. And the major understanding about touch is that there's 5 gears of touch. Almost all couples have only 2 gears. They have affection and they have intercourse. So it's either being an affection couple or being an intercourse couple. That one of the most valuable strategies is to adopt at least 1 and ideally 3 more types of touch. So there's 5 kinds of touch. Affectionate touch, number 1, Number 2 is sensual touch. Number 3 is playful touch. Number 4 is erotic touch. And number 5 is intercourse touch. And affection, which I'm a big fan of, is not sexual. But the other 4 gears are sexual. And one of the ways of thinking about it is think about it on a 10-point scale of subjective pleasure or subjective arousal. 0 is neutral, 10 is orgasm. This is true of both genders. Sensual touch allows you to go from 1 to 3. By the way, affectionate touch anchors you at 1. Sensual touch allows you, as a non-genital, allows you to go from 1 to 3. Examples of sensual touch is back rubs, whole body rubs that are non-genital, just hanging out together. The third kind of touch is playful touch, and that mixes genital and non-genital. In terms of subjective arousal, that allows you to go from 3 to 6. You start feeling turned on, and subjective arousal is more important than objective arousal. And then you get erotic touch, and that's the most controversial. What you mean by erotic touch is subjective arousal between 6 and 10. It doesn't have to go to orgasm, but it can. And that involves manual, oral, rubbing stimulation, or vibrator stimulation. So you really let yourself go and feel highly aroused, and you go with the flow. That one of the most valuable things when you do sex therapy is say to couples, you've got to get into a sensual, playful, erotic intercourse flow. Don't transition to intercourse until your subjective arousal is at least a 7 and ideally an 8. Don't transition to erotic touch until your pleasure is at least a 6. Allow people to be aware of themselves, their bodies, their partner, and their body, and communicate about what really works for you. But it isn't just intercourse. There's so many people that get into this, I'm not going to be sexual unless I want to have intercourse. That one of the valuable exercises that sex therapists give people is they give you a prohibition, not just on intercourse, but often a prohibition on orgasm too. I say, I want you to engage in sensual touch or playful touch and really enjoy pleasure for itself. It's not that you can't go to intercourse or orgasm. That is a really powerful learning experience for folks. Another concept that is very, very valuable for folks, and we're going to have to start wrapping this up because I think we only have 25 minutes before we're going to take some questions and comments and discussion rather than just letting me blob on, is the notion about positive, realistic expectations. That only about less than half of sexual experiences are dynamite for both people. That's the best kind of sex, is synchronous sex, high levels of desire, pleasure, eroticism, and satisfaction for both partners. But most sex is asynchronous. It's good, but it's better for one partner than the other. And it's very, very important to hear that 1 to 15% of sexual encounters are mediocre to satisfying or dysfunctional. That's normal. This idea that good sex is always great sex is junk. That my colleague Mike Metz came up with a concept called good enough sex that says be aware of and value all the different feelings, meanings, experiences, and outcomes of healthy sexuality. One last thing, and then I'm going to turn it over back to Jeff. When you have sexual experiences that are not good, do not talk about it when you're nude in bed after a bad sexual experience. People say and do things that are harmful. The best time to talk sex is in a therapist's office or on a walk with just the two of you or over a cup of tea or a glass of wine. Before you're sexual, when you're dressed, clothed. And talk about what works for you and what is difficult. Because one of the more helpful concepts is that unless you have the power to veto sex, to say no to sex, you don't have the freedom to say yes to it. Because the key element in sexual desire is positive anticipation. And you deserve sexual pleasure in your life. You deserve sexual anticipation. You also deserve to enjoy the experience, even if other things in your life or the relationship are not going well. Even if things are tense, even if you're just lost your job, you still deserve sexual pleasure. And in terms of when things do not go well, instead of complaining or crying or being hurt, turn towards your partner and say, this was a bummer, but we're basically good sexual people. We're a good sexual couple. We deserve to have sexual pleasure in our lives in this relationship. And we love synchronous sex, but we accept that most sex is better for one partner than the other. One of the things that fascinates people about aging is that unlike what you experience in your 20s, in your 60s, sex is often better for the woman than the man because she accepts variable, flexible sex rather than demands individual sex performance. Jeff, you ready to take over with questions and comments?
It's awesome. Awesome stuff. Lots to unpack with that. I love what you just said, that idea when things didn't go so well. But then you also said anticipation, such a big deal. So it's like, this didn't go exactly like we wanted. You can still cuddle and have a good time. But next time, let's find some fun things to do, or let's work on some things. And then on that walk, talk about whatever it is. Maybe it's maybe it's something crazy. Let's pull out the fuzzy handcuffs. It could be anything that you both are like, yeah, that would be fun. Let's try that. But that anticipation that it could be different, that it may be different this next time. Maybe this time you had an orgasm, maybe last time I did, maybe we both will next time, but the anticipation is there's more to come, right?
Right. And one of the things that it also, in terms of talking with each other, is that you are able to share important information. One of the most important discussions that people have that really builds desire, but they usually don't have it, is whether they are partner interaction arousal people. In other words, sex is a dance that you do together, or they're self-entrancement arousal people, where they take turns.
Mm-hmm.
It isn't that one is right and one is wrong. It is, what is your sexual style, and sharing your preferences and feelings. One of the things I say to folks is that you have the right to veto up to 1, 2, or 3 scenarios that are just not you. But you don't have the right to avoid. The more you avoid, the more sexual desire is destroyed. I also say to folks, no duty sex. Duty sex is really bad for you and your partner and your relationship.
Mm.
Sex is all about, there's 2 big things, and then we'll stop again.
No, go ahead.
Good.
It's all good.
It's about consent and it's about pleasure. If you don't have consent and pleasure, you don't have sexual desire.
Excellent, excellent, and so true. And like you said, I do believe that it's so important that you come together around it and figure out what you both will enjoy. I also love the part you said, and I tell my patients 2 things. Communication. I say if you don't start practicing communication around sex, it will never get easier. It will never get better. It will only get better by starting those conversations. And like you said, not in the middle of sex where you're like, oh, I would like it better if you want to have those conversations outside of the bedroom where you can, but the more you do it, the more comfortable it becomes, right?
And not just general communication. I'm a favor of intimacy-based communication. I'm a fan of intimacy. But one of the things that happens in traditional couple therapy that leads many couples astray is they say if you improve your general communication, sex will take care of itself. All you need is a secure bond and intimacy. I'm in favor of secure bonds. I'm in favor of communication and intimacy. But it isn't enough. You've got to combine intimacy with pleasure. You've got to combine intimacy, pleasure with eroticism.
Mm-hmm.
And not getting stuck in the traditional gender roles. The woman needs her erotic voice. The man needs his intimate voice.
And like you said, the other thing to remember is the communication about sex in particular. It becomes easier as you begin to start those dialogues, as you begin to talk about your fantasies, the things you want, the things you need. And then you work together on those things. There's no doubt about it. But I think if you don't, we're programmed, we don't necessarily talk about sex. Our communication style is or yes or whatever, but it's not necessarily real communication, right? Very right, Dr. McCarthy, about sex itself, talking about different things. So I think those can be some really meaningful, helpful conversations, and then how you act on it and how you work together on things.
Right. Well, one of the things that people often ask is what's the difference between sex therapy and regular couple therapy?
Mm-hmm.
And I think they're very complementary. But the thing that makes sex therapy is two things. The one is when you're dealing with other issues, whether it's depression, anxiety, loss of jobs, sexual trauma, or any kind of trauma, you don't lose the sexual focus. So many clinicians, when other things come up, they focus on that rather than sex. You keep the focus on intimacy and sexuality. And then the second is doing psychosexual skill exercises between sessions. The most famous psychosexual skill exercise is Sensate Focus 1, where you take turns and there's a prohibition on sexual touching. But there's all kinds of psychosexual skill exercises that people need to develop. Things like how you get more comfortable with genital touch as opposed to non-genital touch. And what works for pleasure does not work for erotic flow. And one of the reasons people get turned off about sex is they say it's so hard to work toward orgasm. They're right. Sex isn't about work toward orgasm. Sex is being mindful and focused, but it's going with the flow from comfort to pleasure to arousal to erotic flow to orgasm. The flow is good, not working.
Definitely getting in that flow. Excellent. I love too how you talked about everyone is responsible for their own sexuality and orgasm. So there's not this performance anxiety. I'm responsible for you. I'm responsible for me. I'm responsible for what I need and what feels good and what I want. And we work together on it, but it's ultimately my responsibility to verbalize and work with my partner about what I need and want. I think that's a really important point. I try to teach my patients in when we're doing sexuality counseling. Everybody's responsible for their own sexuality, sexual health, and orgasms. Absolutely.
But that's the opposite of what you see in the advertisements. In the advertisements, the man is responsible for the woman's orgasm.
Yes.
And he wants her to have an orgasm like he has a single orgasm during intercourse. Now, one of the things that changes with aging is that his sexual response becomes more variable and flexible, which is a great thing. But one of the things that the woman has to hear is that she has to have her sexual voice, which is often different than his, but it's not adversarial. It's about accepting each other's similarities and differences and working together as an intimate team.
And I work with a lot of gay couples as well. And still, often someone feels like they're responsible for the sexual initiation, the sexual experience. Someone feels more responsible for it, whether it's male on male or female on female or male female. There's that person who feels, oh, it's all on me. It's all on me. And it's like, no, the beauty of it is it's all on us. It's all on us.
Well, it's about sharing pleasure, not performing for. Pleasure frees you. Performance keeps you behind the eight ball. You
I
don't
love
want to be behind the eight ball.
I love that. Yes, I agree. We have a question here.
Yeah.
How do you think the porn industry affects intimacy?
Porn and intimacy are very different phenomena. Let's try to say it positively first without problematic. Intimacy alone is not enough to be sexual. It's really valuable, but intimacy needs to be balanced with pleasure and eroticism. If you don't like the word eroticism, and some people don't, think about the word about vital or energized sexuality. Porn, on the other hand, is not about blending. Porn is about an erotic fantasy theme about traditional male sexuality. It's about fantasy. It's not about real life individuals or couples. In fantasy, in porn, people always have spontaneous erections and they always have great orgasms. That is not realistic. Porn is about trying to get you off, especially when you're masturbating. Now, people say for everybody can become a porn addict. That's not true. Empirically, well less than 5% of men and well less than 2% of women get into a compulsive misuse of porn. But the majority of people who use porn, same with the majority of people who masturbate. It's a different sexual outlet. It isn't a competitive sexual outlet. It only becomes problematic when it's tied to shame. Of all the human emotions, shame is the most devastating, destructive. The more shameful you feel about sex, the more you get stuck in your power struggle, the more you get stuck in shameful fantasies or destructive, compulsive behaviors.
And two, I think it can become, instead of about how can I be the best me and have the best sexual experience, and about my partner, it becomes about comparison, which is another reason for suffering too. We're comparing, oh, look at this person in the porn's genitalia, look at mine, look at how their body is, look at mine. And I think that's where it can become problematic for some people, not everyone, is comparison, because comparison is a source of suffering. I also wanted to talk a little bit about, because I know we have some handouts that you can get as well, and Vic has put them on the website from that Dr. McCarthy so generously shared with us. And so everybody thinks, well, everybody's sexual, right? Because that's what the media tells us. All marriages are sexual, and if you don't get married, you'll stay sexual longer. This is the myths that are out there, right? But we both know that's not exactly right? Everybody's not.
It's exactly not right, is what it is.
So right?
Again, I love the limerence phase, but it's not a basis for sexual desire. The basis for continuing sexual desire is that blending of intimacy, pleasure, and eroticism. That's what allows people to be healthy and really involved with each other.
Yeah. And the handouts have some really great information and some exercises and stuff too. But you remind us that 1 in 5 married couples are non-sexual. That means they have sex less than 10 times a year. And here's important too. 1 in 3 non-married couples who have been together 2 years or longer have non-sexual relationships. So long-term monogamous relationships, some become somewhat non-sexual, but they don't have to. You can revitalize sex. You can do all those things. And that's a lot of what I appreciate about the work you've done, the books you've written, to help people know how to keep desire alive, how to revitalize desire, and the messages behind that.
Well, the handouts, by the way, none of them are copyrighted. So you can feel free to change them any way you want, use them any way you want. Our best book in terms of desire is the 3rd edition of Rekindling Desire, which is a couples book.
Excellent. It's an excellent book.
The message is people can change and enjoy their sexuality, whether in their teens, their 20s, their 60s, their 70s, whether they're straight or gay or bisexual plus, whether they have alternative sexualities or they're mainstream. The question is, what is the right fit for you in terms of sex really does work for you? And again, there's a theory about sexuality that I always like called the dual control theory, about accelerators and brakes. And what we used to believe years ago when I trained was that the real issue is increasing the accelerator, what turns you on. The truth for most people, especially about desire, is the real issue is loosening the brakes. There are too many brakes on your sexuality.
You know, that is really good information. And I love that analogy with the gas and the brakes and how it helps us with both pieces of it. You have given us such great information, and I hope you'll be willing to come back again. There's so much to unpack. We could talk, and you can talk maybe a little bit more about some exercises, some other things that might be helpful, and dive even deeper into some of the issues around desire, because you are my go-to person for a lot of that. And your book, which I know your wife was a part of that as well, Rekindling Desire, I highly recommend that third edition. It's I use it with my patients, and I think it's very helpful. I thank you so much for sharing. Is there anything you want to say before I go to sort of our grounding thing, and we'll move on to other things? Is there anything else you want to tell the audience?
The biggest thing that I want you to take from this is about the importance of responsive desire, the importance of blending intimacy, pleasure, and eroticism, and the importance of accepting that good enough sex. It really is an empowering concept. It doesn't sound great, but it's an empowering concept. It motivates you to accept that sexuality has different roles, meanings, and outcomes in your life and in your relationship. And the paradox sexually is when it's healthy, it plays this 15 to 20% role of energizing you in a relationship. When it's unhealthy or avoided or in a power struggle, plays an enormously powerful negative role. The notion is that good sex will not save a fatally flawed relationship. But the much more common pattern is that sexual problems, sexual conflict, bad sex subverts loving relationships. The paradox is bad sex is more powerful and destructive than the positive role of good sex. But you can switch to your ending.
Awesome information. I really hope you'll come back and even tell us more about the good enough sex model and the desire, and a little dive deeper into desire. Such good information. Thank you so much for joining us. As we end, as you all know, I like to end with you by grounding you just a little bit. So let's end with a grounding exercise. Get comfortable. You know how we do this if you've been here before. Put your feet flat on the floor, lay down, get in a comfortable position. And I want you to begin taking deep breaths. 4 or 5 counts in, gently exhaling for 4 or 5 counts. 4 or 5 counts in, breathe, fill your chest and abdomen fully, and exhale. 4 or 5 counts. Keep breathing that way. And as you breathe, remind yourself of this truth. You are inherently worthy of love and belonging. Our greatest desire is to be seen, heard, and loved for who we truly are. As you exhale, affirm the power of I am. Say to yourself, I am peaceful. It's powerful. I am content. I am healthy. I am love. I am enough. I am peaceful. I am content. I am healthy. I am love. I am enough. Carry this affirmation with you as you move forward through your days, knowing that you are truly deserving of love, connection, intimacy, joy, and sex. I thank you so much for joining us. Vic is going to show us a little bit about what's coming next week now. So let's roll that.
When oral medications for erectile dysfunction are ineffective or not an option, the vacuum erection device is the second most common FDA-approved treatment used by men. With a 90% success rate, research shows that achieving success depends on excellent instruction and consistent practice to master the device. In this episode, DrJeff is joined by a certified urology nurse practitioner and expert in erectile dysfunction to share practical, evidence-based tips for ensuring success with the vacuum erection device. Whether you're new to the device or looking to improve your results, this episode provides the guidance you need. Join us next week to learn more.
So next week's going to be great. We are going to pull out the vacuum pump. We're going to dive deep into it. If you're not interested in that, it might not be the episode for you. But if you really want to know some helpful tips, because it's all about practice and patience, but it can be a helpful device. Sometimes we're going to get very specific. And next week, we're going to get very specific as nurse practitioner Kathy Marchese joins me so we can both share what we can tell you to help you. How would you incorporate a vacuum device into your love play and tips to help you be successful with that if you want to do that? This can be very valuable for men who are thinking about one, are using one, or need help with it. Again, nothing replaces one-on-one help. So I gave you those tips earlier on some helpful how to find a healthcare provider. It has been such an honor and pleasure to be with you this evening, and I thank our guest, Dr. Barry McCarthy. I hope he'll come back. I know he probably will, to share more of his expertise. We learned a lot. Barry, I hope you'll come back and join us so we can dive deeper into some of this stuff. Thank you for joining us this evening.
Glad to do that.
Have a great